tonight's session, Parenting Neurodiversity, Connecting the Dots and Seeing the Bigger Picture. Thank you all to our parents, carers, educators, community members, and supporters for joining us tonight. Tonight is about creating space for learning, connection, and understanding, exploring how we can better support neurodivergent children and whānau by looking beyond the labels and seeing the whole picture. We are honored to have Tsitsi Kavumbura, a health improvement practitioner and neuro-affirming mental health clinician, with us this evening. Tsitsi will share practical insights from both her professional experience and lived realities to support families navigating neurodiversity. Just a quick notes around housekeeping. So please feel free to please keep your microphones muted and feel free to add questions in the chat, and we will have time for discussion and Q&A at the end. We also encourage respectful and open korero, as we all come from different experiences and perspectives. With that, I will hand over to Tsitsi. Over to you, Tsitsi.
Thank you, Angie, and welcome everyone. So tonight is about celebrating our cultural experiences, our strengths, our perspectives, and those, whatever we bring into this space of supporting children. So just a little bit about myself. So as Angie said, I am kind of using two lenses, coming from my personal experience of raising a neurodiverse child and also as a mental health clinician. So these insights have helped shape this presentation. And the main thing about today is building understanding of neurodiversity, and especially through the lens, through my own personal lens, connecting the dots, especially around gender differences, and also seeing the bigger picture. We'll also explore some practical strategies for navigating parenting in a new way and understanding and embracing the neurodivergent experience. So I came across this poem by Emily Kingsley, and I'm going to summarize or paraphrase the poem. It's called Welcome to Holland. I don't know if anyone has come across it, but when I read this poem, it resonated. It actually resonated with my experience. So basically, she wrote this poem trying to help people understand the experience of raising a child with disability, helping them share that unique experience. So basically, I'll just read the paraphrase here. When you're going to have a baby, it's like planning a fabulous vacation trip to Italy. So you buy a bunch of guidebooks, you make your wonderful plans, but you find that there's been a change in the flight plan and you find yourself landing in Holland. So you kind of hear the pilot saying, oh, welcome to Holland. And then you ask yourself, but I was supposed to be going to Italy. I knew everything. I practiced the languaging. I practiced everything about Italy. But then you find that you're in Holland and you must stay in Holland. So what do? You have to buy new guidebooks. You have to find a new way of embracing life in Holland. You have to find new connections. You have to learn a new language. So for me, that was my experience. And I'll share a little bit about how I did not realize that I was in Holland until 15 years later. So if you hear me using the Holland, Italy, this is where it's coming from, where Italy is where everyone is supposed to be. All the parents talk about the wonderful experiences with their children. And it's like Italy, the vacation that everybody wants. But then you find yourself in Holland. And Holland is not a bad place, but it's just not what you prepared for. So sometimes you might find yourself spending time mourning about the journey that you thought you would have. And so you will never actually enjoy what you have until you have that shift in perspective. So I'm hoping that part of our conversation tonight is about looking at how we can embrace life in Holland, how we can make things work and embrace a new reality. Now, as I mentioned earlier, that I did not realize I was in Holland until 15 years later. I'm a mom to two wonderful girls, and they're very intelligent as well. So I did not realize that one of them was both ADHD and autistic. And what I can describe is the first 15 years of raising that child, life was just so hard. I felt like a bad parent. I criticized myself, and all the books that I had read, all the parenting books, the parenting classes that I had read, nothing worked. And I was thinking, what's going on? And so I didn't understand what was going on. And I kept criticizing myself until we got a diagnosis. And I'll share again how that journey was for me. Getting a diagnosis was like a double-edged sword. So on one end, there was the relief of knowing that I wasn't a bad parent after all, and that my child was wired differently. And so I had to think about, okay, if I'm not a bad parent and my child is wired differently, then maybe I need to look at how best to parent that child. But then on the other end of that sword is the profound grief that I experienced. I don't know if some of you relate to that. So for some of you, maybe you find out maybe in the first few years. But for me, I had been parenting my child a certain way, and I had expectations, thinking I'm raising a neurotypical child. And so realizing that my child is wired differently, that grief was at a few layers. Part of it was mourning the gap between expectations and reality. Remember again that analogy about Italy. Italy, everybody talks about Italy, milestones and everything. And then you find that you're in Holland and everything is different. So there's that gap between expectations and reality. Loss of that typical linear path in a world that's not built for neurodivergent people. And so that was part of my grief, that anticipatory grief of worrying about my child's future. Not because something has changed, she can't do things anymore, no, but it's just worrying about, I know the world doesn't really embrace neurodiversity. And so it's that worry about their future, how their needs will evolve, what will independence look like, would they do things? Because I thought she knew she had all the skills, but then now realizing that, so being neurodivergent means that she's got gaps that are going to be that need to be filled somehow. So that was the anticipatory grief. And then on the other part was also the grief of lost expectations, letting go of the milestones and social experiences that you thought you would share. For me personally, my child doesn't share the same humor that I have or that I see other people having. The relationship is different. We have to navigate things a little bit different. And so I still mourn. That grief is still there. And I'm still kind of embracing it. So it's not something that just comes and goes. So I imagined Italy, but I arrived in Holland. And my Holland was like, so I was in Holland all along. And sometimes the difference between those two places can feel quite intense. So I have to keep reminding myself that it is what it is. I'm in Holland and I will make it work. And those are the challenges of parenting a neurodivergent child. Now, we are going to move on to how did I not realize that I was in Holland? Or how did I not realize that my child was different? I'm pretty sure some of you may be aware that things like ADHD and autism, mostly ADHD, looks actually different in boys and girls. This difference is often overlooked. So I will touch a little bit on that. And based on my personal experience, again, with my child, things that I only realized maybe 15 years later that were missed along the way, missed by professionals, missed by everyone who knew her. So one of the things is that I think that may be quite common for some people that are familiar with maybe boys and girls with ADHD. Many girls don't display the stereotypical behavior, so they are not climbing up the walls, they are not as hyperactive and disruptive, and so they get missed. So one of the things that what I noticed with my daughter is their struggles are internalized. They're very quiet, and so you can easily overlook them. Some of these things that I noticed in my child, and when I look at some of the symptoms of ADHD in girls, she fit perfectly in those things, but at the time, nobody knew. So sometimes you just think that, oh, my child is just quiet, is just shy, or they are a daydreamer. I remember when she was in year 1, and I dreaded every parent-teacher meeting, because every time my child there was something about my child. Your child is always away with the fairies. Your child is always disruptive in class. So her disruptive, she talks a lot, but all the other things were kind of like, they seemed normal. And I remember, so those were like, the first few years were like that. And then as she kept going, when you just start, and then because girls are good at masking, they fit in with everybody else. And then you don't realize that they're struggling. So they fit in, and then they just keep going. So there was a time when she seemed, I would say normal in quotes, she seemed neurotypical, because she was masking, she was fitting in with her friends, she was getting along, and she was getting her work done. But what I noticed as well, and that's something to look out for, especially in girls, my child would come home exhausted, because masking is exhausting. Because at school, she's trying to be the typical child. And then at home, she comes and there's no energy left. And so what teachers saw was a well-behaved child rather than someone who's overwhelmed. And then some of the things that girls may tend to do, because they internalize a lot of things, they become quite sensitive and anxious. So those are things that I also noticed with my child. And they do things, they follow everything. I remember when my child was in high school, that's when things started falling apart a little bit on the social side and also academic side. What she would do is she would get everything done, but there was a lot of anxiety. And I remember talking to my daughter's science teacher, and while we were trying to navigate the diagnosis, and her response was so dismissive. She actually got upset with me for even suggesting that my daughter had ADHD. She's like, no, your daughter is a model student. She's so smart. So she was too smart to have ADHD, and she got her work done. So for her, it was, she cannot have ADHD because she's not fitting that criteria. And so so I actually started thinking, am I gaslighting myself, or what is going on here? But the more that you kind of tune in and look at all these things, the more you realize that my child is actually not coping. And one of the things as well that I noticed with my child, and that may be, you may notice maybe with some, especially some girls, because they internalize, they often tend to skin pick, or they end up self-harming, or sometimes having suicidal thoughts. With my child, it was more of the skin picking. That anxiety and overwhelm was so much, and so she would pick on her cuticles. And I remember taking her to the doctor, and the doctor was just like, oh, she's just anxious. And in my head, I'm thinking, what kind of anxiety is this? Thankfully, at the time, I was working in specialist child and adolescent mental health services. And so I was seeing children, I was helping assess children with ADHD. And I remember going through these questions and thinking, oh, that looks like my child. That sounds like my child. And so for me, that information helped me to actually fight for that diagnosis. Some of the things that also that are quite that you notice with girls. So we talked about the masking. Sometimes they're just quiet and compliant. They're disorganized. Everything is all over the place. And those are things that I noticed with my child as well. With social relationships, because they tend to miss social cues. And as you know, that girls' relationships are so complex. So they tend to miss social cues. So again, that's when my child started struggling in high school, because she couldn't keep up. And so she would come home in tears every single day, because nobody wants to play with her, or she doesn't even know what's happening. And she just got left out in every situation. And so those things as well, they are part of things to look out for. And for some people, some children, you'll notice intense emotional outbursts or meltdowns after school. And when you ask school, perfect child, but what you get at home is that child who is just so over it. She's been holding it together, or he has been holding it together, and then they just fall apart at home. And so that can be quite confusing for families, especially when the teacher's report keeps saying, oh, they're doing fine, they're doing fine. And so you end up thinking, am I just making things up or what? So my encouragement to you is, if you notice something that's not right, trust your gut. Have a read about that, know a little bit about that, because some of these things, your child is struggling. Sometimes they are so forgetful. You say something to them and it just goes out the other ear, and you think, what's going on here? And then one last thing to just mention about the struggles that I noticed with my child. She would lose every single thing. Whatever you gave her, she would just lose it. And nothing ever lasted. So even just school uniforms, we had to be at the lost and found property every single day. And so it's those little things that we kind of thought, oh, it's just okay. But then because the teachers were saying, she's fine, she's fine. And I remember even my first attempt to pursue a diagnosis through the specialist services, because the corners forms, which are the forms that they use, excuse me, the forms that they use for assessment, from their point of view, from the school's point of view, she was absolutely fine. And so when we went to specialist mental health services, they looked at that and they just thought, oh no, these are just problems at home. So again, those things can easily be dismissed, but I always encourage people, keep fighting, because those things will get missed. And then the problem with especially girls is they end up struggling for longer. So if you can fight until they get a diagnosis, then keep fighting. I think we have time to talk about that during the question and answer time. So what were the advantages of getting a diagnosis? Some people don't want to know, but for me, honestly, it validated my child's experience. And I think because she was also 15, she actually, she realized that she wasn't stupid, she wasn't dumb, she wasn't just making things up. It also validated my experience as a parent, because I remember actually crying that day and thinking, I'm not a bad parent. I just need to, I just need to embrace that this is what it is. And then, it became easier, honestly, with the diagnosis. At school, she was able to get accommodations. We were able to advocate for things to work a little bit better. So the good thing about having a diagnosis is that it gives language to what you've always felt. And it's the beginning of a new and more informed chapter, and not the end of hope. And so if you are thinking about it and kind of sitting on the fence and thinking, what's the benefit? It's not always about medication, but it's something that kind of gives meaning. And it's also important to mention that, and this is me putting on my clinical hat, that a diagnosis is not a label that limits. It's a key that unlocks the right doors for your child and your family. And for some people that are thinking of a diagnosis later on as well, it's the same thing. Don't hold that label lightly. It's not something, it's not a disability or anything, but you can use it to make things work for you. Okay, so I've given a brief background of how my journey changed from Italy to Holland and what life was like in Holland. Now, the next part is about rethinking parenting. Again, sharing my own experience. Why I struggled the first 15 years is because I was looking at the standard parenting rules, and those don't often apply when you're raising a neurodivergent child. Sadly, I only realized it 15 years later. And as we know, children don't come with a manual, and neurodivergent children definitely do not. What I have found in my journey is that parenting neurodivergent children is one of the most challenging things, but it's also a rewarding journey. So you have to deal with meltdowns, rigid routines, that emotional intensity, and sometimes it can be exhausting. And remember that grief I mentioned earlier. You're still kind of working with that. And then there's a level of anxiety that I've also noticed in myself, where it's just, you just don't know. You're worried, and you're also wanting your child to be independent, but at the same time, you don't know what they can and what they can't do. And then the other thing that also comes is, once you know what your child struggles with, then you have to make adjustments. And so that's also hard because you've always done life this way. And standard parenting says this. And so sometimes just making that change can be quite challenging. So that's why it's important to look at the bigger picture, which means you're understanding your child's unique wiring. You're understanding their strengths, their challenges, and the way that they experience the world. One of the examples that I often give that we had to adjust to, we still struggle with that, is we found that our daughter gets stimulated, or she actually gets overwhelmed by the sound of a fork on a plate. So we're all eating using our forks and knives, and scratching that plate for her, it's not good. And so now we have to be we have to be very careful around here. And so we had to make some accommodations, but sometimes you forget. And so it's a journey that's kind of frustrating at times. But as I said, there are rewards that you can get there. When your child's brain is wired differently, your parenting approach has to be different. That standard parenting is not gonna, it's gonna fall short, because remember, they were designed for neurotypical children. It's also important to remember that your child's behavior is often a sign that they're struggling. So their behavior is communicating something, and it's not just failure to comply. So that big picture perspective helps you to see what else is happening. Is there another way of looking at this? And rethinking parenting means we are shifting from asking, how do I make my child comply, to what is my child communicating and what support do they need? The goal is not to force neurodivergent children into neurotypical boxes, but it's actually to understand and support the way that their brains work and put in those supports so that we are able to parent a bit more effectively and still raise an independent child. One of those things is to focus on connection, regulation, understanding, and skill building rather than punishment and control. You'll find that some standard parenting courses are focusing maybe on rewards and punishment. It looks very different with neurodivergent children. And again, I'm sharing my own experience, and I know we all have our different experiences. So it's about knowing what works for your child. Part of that journey is letting go of the many shoulds that we carry as parents. My child should, I should do this. Your parenting doesn't have to look like everyone else's to be effective. This is your journey. And so it's okay to navigate your journey the way that works for you. Your home may be messier than other homes. And you might need to be more flexible than other families' homes. You might need to change things a little bit than other people, and that's okay. Your routines and expectations may look different from those of your friends. So that comparison trap can easily become the "oh, should." But then what that does, it just makes things worse for you, and it just makes life a bit more difficult. So comparison, basically, when parenting a neurodivergent child, it's really helpful. What matters most is finding what works for your child and for your family. Just because they're different doesn't mean something is wrong. And it's also good, and this is something that we'll talk about later, knowing that your parenting is good enough. What you are doing what works for your family. Now, for us to actually get to this point where we rethink parenting, I think it's important to kind of go back a little bit to understanding a little bit about the science of the neurodivergent brain. So I'm going to put my clinical hat again, and we will talk a little bit about the brain. If some of you have attended the previous webinar, we did talk about stress, and I will talk about it again. So the adolescent brain shares surprising similarities with the toddler brain. Both are still developing the capacity for self-regulation. Now, the adolescent brain and the toddler brain, they are also very similar to the neurodivergent brain. And during that time, their frontal cortex, which is responsible for the logic, is not fully connected, which means they're mostly in their emotional brain. And when emotional brain takes over, the rational thinking is not there. So understanding that part helps us to respond with patience rather than frustration. So I love trying to think of his name, Daniel Siegel. He does the hand-brain model that explains nicely how the brain works. So some of you may have come across it, and I'm going to try and demonstrate it. I hope you can see that. And so think of this part here representing the brain stem. So that's the part that's responsible for our survival functions, where the heart rate, the breathing, and the physical reactions is the part that keeps us alive. And then if I take my thumb and fold it on here, that represents the limbic brain, or the limbic system, which is the fight, flight, or freeze system. This part here is highly sensitive to threats, whether they are real or perceived. And so when triggered, it takes over. Now, normally, if I cover my thumb with the rest of my fingers, this part here represents our frontal cortex, which is the part that does the thinking. Now, because remember that brain, that the adolescent brain, the toddler brain, the neurodivergent brain, they're quite similar. They're mostly emotional. So if there is a real or perceived threat, it flips. And so when they flip their lid, they're offline. And so this part here, they're in this brain. So that's where the meltdowns are happening. That's where all that behavior is coming from. There's no reasoning capacity at all. And so no matter what you say here, when they're in this state, nothing is going to change them. You have to help them calm down first, connect, get back online, so that you're able to talk to the logic brain. So having that understanding that for us as parents, we'll also flip our lid, because parenting a neurodivergent child is hard. And so often our lid will flip. But the good thing with us as adults is we can learn to regulate. And so that regulation, we can also pass it on. So that will be the next thing we talk about. But I just thought maybe we'll emphasize a little bit on this part, that knowing that when we're in offline mode, there's nothing that's happening. We are in full meltdown. So this is our dysregulated state, and that's our regulated state. So you want to talk with the regulated state. Now, these states are like a scale. I want you to think of like a scale, the emotion and the logic brain. They cannot be balanced at the same time all the time. So if one takes over, the other one disappears. And so we have to be able to recognize which part we are in first and which part my child is in, so that we know when to intervene. Now, for us to help our children calm down here, we have to regulate ourselves first. So we are stepping into parental well-being. If you are not regulated and you are in your emotion brain, what's going to happen here? You're going to be yelling at the child, you're going to be screaming, you're going to be giving them maybe unrealistic expectations, which just makes things worse. And so what we want to do is to think of, how do we connect before we correct? When we are depleted, anxious, or burnt out, again, it's coming from the overdrive here. We lose our capacity to support our children effectively. And so there's also risk of chronic anxiety and depression, and when we are in that state, we can't help our children regulate. And so again, we end up not being the parents that we want to be. So we have to learn to regulate ourselves so that our children can regulate, they can match our regulation. That takes us to the next part, which is, how do we regulate ourselves? How do we get ourselves back into this state here? Dr. Bruce Perry, I think he's one of the psychiatrists, he said a statement that I really liked. He said, a dysregulated adult will never regulate a dysregulated child. So if you are both in here, you cannot regulate your child. So you have to regulate yourself first. Our calm presence is the most powerful tool that we have. When we are grounded, and grounded is deregulated, we create that safety to our children so that they're able to return to their thinking brain. And sometimes it takes just some small intentional actions to shift that nervous system from the reactive to the responsive, and that can make all the difference. So some things that you can do to regulate yourself is slowing down your breathing. So when you slow down your breathing, it's like you're putting on the brakes to that nervous system. So when you slow your breathing, you're sending a message of calm or safety to your brain. You are settling your nervous system. It also helps you regulate or settle your body language, because if your body language is threatening to the child, they are already in this state. And so you actually need to model calm to them. So take some deep, visible breaths so that they can see you doing that. Lower your voice, speak slowly and calmly, and use a steady voice when responding. Be mindful of your posture. Be mindful of your own body language. If you are standing over them, that's quite threatening. So sometimes coming down to their level can actually help them to feel a little bit safe. These things are easier said than done, let's be honest, because when you're in that moment, sometimes you don't even think about that. But if you notice that you are still dysregulated and you're unable to calm down first, sometimes it's okay to step away. Give yourself a timeout. I remember having to do that a few times, where you just kind of go to the bathroom or to your bedroom, give yourself a timeout, and then when you come out, you are a little bit more regulated and you can help your child regulate. So what we are doing here is, when we are regulating ourselves, we are creating that calm presence and the child feels safe and settled. And we can also help them to co-regulate. So co-regulation is, you are helping the child to regulate with you. So that breathing, you can do it together. And you can also validate their emotions. So validating their emotions when you're talking, it's not like giving them permission to throw a tantrum, but you're actually saying, hey, I see you. I can see you are struggling here. We'll talk a little bit more about that. But once you calm yourself down, then you're also able to connect. You are able to offer that safety and comfort before you correct. Remember that when a child is dysregulated, they're offline. So don't try to use any logic. Don't try to correct. All those things can wait until the child feels safe. And now once they are safe and their thinking brain is back online, then you can talk about, okay, so what happened? You can offer a gentle hug sometimes. So for some children, know what your children need. Some children are not huggers when they're in that state. So don't try and force your child to hug you when they're dysregulated. It just makes things worse. So if they're a hugger, offer them a hug, a quiet space, offer them maybe something like a soft toy, anything that helps them to soothe their nervous system. Water is a really good tool, and especially for us adults as well. So neurologically, you can't dysregulate while you're swallowing. You can't swallow water and hyperventilate at the same time. When you drink water, your body produces saliva, and saliva tells your brain that you are safe, because the brain knows that you cannot have saliva when you're unsafe. Because normally when we are in this state, salivary glands dry up. And so water is a really good tool for ourselves and also for the child. You can give them a glass of water to drink, or you can also give them maybe their favorite hot drink, and you can do some hot drink breathing with them, where they breathe in and breathe out. So you are helping them to get their calm before you start talking about what's happening. The validation that I mentioned earlier is more about naming the emotion. So you can see that they're frustrated. Sometimes they don't, because they're in here, they actually don't know what's happening. So you're helping them to name it, to tame it. If they know what it is, then they're able to tame that emotion. It helps reduce the intensity of that emotion. And it also helps them to feel seen and heard. So validation is that sometimes just simply saying, hey, I can see you're feeling really frustrated right now. And then you offer maybe, would you like a quiet space? What would you like right now? Again, we can't do that when we're in here. We can only do that when we've calmed down first. So just saying that validation is more powerful than any explanation or correction. You are telling the child, I see you and I hear you and I can see you're struggling. So that empathy reduces that intensity of the emotion. Sorry, I will just keep going because we've got a few things to go through, and then we'll take questions later. Now, after we've calmed ourselves down, let's now look at some practical strategies that we can implement. Here, I would like to say that it's important to remember that every neurodivergent child is different and their needs are unique. And so what works for my child may not work for your child. So every family's journey is different. There's no one size fits all. So that's why it's very difficult to have like a guidebook of how to parent your child. Your child is your child. So you need to be flexible and meet your child just where you are or where they are. Adapt these strategies to what works for your family, and also sometimes for the different season. For me, it's a season of raising teenagers with all those challenges. And so there are so many things that maybe if I had known earlier, I would have done them differently. But now, because of the season that I am in, it's teenagers that are almost getting into adulthood. And so I have to adjust and do what works for me. So find what the season is. Also, bring in your family's cultural lens. How does your culture support this? And sometimes with the cultural part of it, some cultures, to be honest, they are not very validating because those things do not exist in our cultures. So you know your child. So sometimes you might need to make adaptations to the cultural approach there. Remember, they're offline. You can't reason, you can't correct, you can't teach. You have to wait until they calm down. So one of the things is to reduce demands when they're in that dysregulated state. Take off that pressure to understand what happened. Why did you do this? Or trying to give them instructions. Nothing goes in there offline. So remove those instructions, the expectations. Don't try to teach. Don't try to problem solve or correct when their brain is offline. But instead, help to create that calm environment where your child is able to perform or where they're able to settle without the pressure to perform or comply. So you are creating an environment where both of you are feeling safe, you're both feeling respected, and then your nervous system can rest with fewer demands. So that's about having realistic expectations of your child as well. Sometimes silence can just be a good gift. Just your calm presence alongside your child without any words can be quite good. Again, if they're huggers, just a quiet hug and just sitting down with them. Sometimes it can be more powerful than whatever you can say. Pick your battles and ask yourself, is my response helpful or making things worse? Because sometimes what we think works doesn't work, it just makes things worse. And remember, again, we did talk about the culture. Some of the cultures that we grew up in had a certain way and expectations that do not work anymore. And so sometimes it's about adjusting and actually say that script needs to be corrected. It's not going to work anymore. So do what works for your family. Focus on helping them feel safe. Remember, connection first, then correction afterwards. And then once they're back in their calm brain, then talk through what happened. Give them that space, validate without any blame. Try to understand, build some coping skills together over time. And these coping skills, they don't just get them immediately because their brain is wired differently. So you've got to be patient and give them the space that they need sometimes and work with them on a plan that works. Sometimes it's also good to use that time when they're back in their calm brain to think about what we would call a cope ahead plan. So a cope ahead plan is where you say, hey, this happened. When this happens next time, what can you do? What helps you? Do you need to go to your room? Do you need a safe space? What do you need? So you're kind of talking to the calm brain to problem solve and plan for when the meltdown happens. It's not a foolproof plan, things are going to change, but it's good to kind of know that, okay, these are some of the things that work. So sometimes it might be about, okay, do we need some self-soothing strategies, or do we need some toys? What do we need? What can help my child get their calm so that they're able to make a few steps, or they're able to regulate first? And unfortunately, with the neurodivergent child, sometimes we have to teach the same thing over and over and over again. So repetition and patience will help build those neural pathways. You can't just tell them once and think they got it. So sometimes you might have to repeat the same thing over and over again. And also acknowledging that even if they take a small step, that's still a step forward. Some days will feel like you've done nothing at all. So it is really important to be patient with ourselves and with our children, and also to just have realistic expectations of them and of ourselves. The other part to teach our children as well is, I like this analogy of the traffic light system: the stop, which is the red part, the think, and then the do. Some teachers might recognize that from, they use it to help children problem solve. So I often use it with patients the people that I work with. It's important to know that we can teach them to stop. And when they stop, we ask them, we're kind of giving them that space to regulate. And then when they're back in their calm brain, they think about what happened, and then they do the right thing. So sometimes just having like a visual of the stop, the think, and then you do. What do you need to do? So that can also be quite helpful too. It's a helpful tool to teach kids for next time for problem solving. We talked about realistic expectations a little bit. Your child's executive function is very different. So usually for people that are neurodivergent, it's lower than their age. And so sometimes your expectations of, oh, my 18-year-old or my 20-year-old should be doing this, sometimes they may actually be lower than that. So sometimes you have to do 80% of the work initially, especially if you start young. It's much better. You do 80% of the work, and then you reduce the load and build up gradually. So as you teach them, remember that repetition. You have to keep repeating. And sometimes you may have to use some things that help them remember. So visuals, timers, use whatever you need to use to help them learn those skills. Gentle reminders without frustration or judgment. Your child is already struggling. And so the last thing that they need is frustration and judgment about the things that they can't do. Sometimes you might need to break tasks into smaller and manageable steps. So that expectation of, oh, my child should know how to do this. Let's have realistic expectations of our children. We celebrate the effort, not the outcomes. They might not do things perfectly, but they are making some effort. And so what we are doing here is we are adjusting our expectations to our child's current capacity, not their age. So that's something that we need to remember. So we are lowering the bar purposely. And this is not about giving up, but this is about meeting your child where they are. And when you are telling them, or when you're giving them instructions, describe in as much simple detail as possible. That's one thing I found frustrating with my child, because before, when I thought she was neurotypical, I would just say maybe 2-3 sentences in a row. Do this and do that and do that. And my child is just looking at me with a, what? And so now I find that I have to fill in the gaps. And sometimes you just kind of say a statement and you think they read between the lines. I found that my child can't read between the lines. And so I have to to give as much detail as possible, checking they understand what you're asking them to do. So that may also mean that we are adapting the way that we speak. We are adapting the pace so that the children get understanding. And with realistic expectations, it's also about adapting our environment so that it's more supportive to these children. I mentioned my child's struggle with the scratching of the fork on the plate. And so we've encouraged her to wear her earbuds or headphones. And at school, if it's overwhelming, she can wear headphones. And so sometimes whatever can help to reduce that sensory overwhelm, you can help them and support them to do that. If you build a supportive environment, it helps to reduce those sensory triggers. It helps build their independence, and they know how to navigate different environments. And it also helps them to feel safe and understood, both at home and beyond. We talked about just having things that help them stay organized. So visual schedules, checklists, whiteboards, where you write things down. So because out of sight, out of mind. So if they see it, then they remember. And sometimes reminders, sometimes alarms, whatever you need to use, timers, because most of the time they don't have a sense of time. So those small changes that you can make to your child's surrounding can reduce that overwhelm. And then it creates a calmer environment for everybody else. So give your children the chance to use the skills, and also support them to ensure that they are not going to fail. There's the concept of scaffolding, where you help them as much as you can. Neurotypical children, they get a little bit of help and they're off doing their thing. With neurodivergent children, you may need to keep scaffolding them even into their adulthood. So sometimes we just have to have realistic expectations of themselves, of them and of ourselves. Predictability can be your friend. Neurodivergent children thrive when they know what to expect. So if you give them expectations, so that's why those visual schedules and daily routines help. Timers help to ease transition between activities. So you're kind of telling them, okay, in 10 minutes time, we are leaving. You don't just go to your child and go, oh, let's leave now. I can't tell you how many times my child has had a meltdown because we just said, oh, we're leaving now. And we didn't give her a warning. And remember, this is a teenage child, where other teenagers will just, do things differently. And now we have to give our child a warning. We are leaving in 30 minutes. We are leaving in 10 minutes. And so having those timers has been quite helpful. So it is frustrating, but what else can we do? We're in Holland, so we have to adapt our parenting. For younger children, having some consistent rituals, morning and night. So maybe it might, especially the breathing that we talked about, they don't just get it. And don't try and use it only when they're overwhelmed. Make it a part of a routine. Maybe every time you're eating, use some breathing, and have some clear and consistent boundaries so they know what to expect. Boundaries help them to feel safe. So sometimes some parents feel so guilty about their child's struggles that they don't put any boundaries. Boundaries are actually quite comforting. So don't be afraid to put those boundaries. They help the child to feel safe. I'm aware of our time, so I'll just rush through the next few ones. Clear and specific communication. So use simple sentences, sometimes one instruction at a time. Check understanding, allow processing time. Stay calm and neutral in your tone. Advocating for your child is very essential. So sometimes you might need to advocate at school. You are the expert on your child. So advocacy sometimes starts with advocating, even for getting a diagnosis, saying that, hey, something is not right with my child, she needs support. And so advocate. Learn their rights, ask questions, request assessments, push for the support that they deserve, be informed, and that will open doors that would otherwise remain closed. So work with the school, work with whoever is working with your child, and advocate for your child. Find support. You don't have to do this alone. Connect with other neurodivergent affirming groups. Reach out for coaches, for counselors who truly understand your experiences. Sometimes online communities can be helpful, and organizations like MIN are good for that. So reach out, ask questions, allow others to walk alongside you. And it's also important to seek support from people that really get you, because sometimes you seek support and people invalidate you and they make you feel worse. You're already struggling. So seek support from the people that actually get you. And the last part is about the oxygen mask. We all know about the oxygen mask metaphor, that you can't, if you are busy taking care of everybody else and you don't put an oxygen mask on yourself, it's not going to work. You can't pour from an empty cup. So it's okay for you to regularly check in with yourself, validate yourself, ask yourself what you need. What do I need? What kind of rest do I need? Have some small, consistent acts of self-care. There's no one size fits all. Do what works. Sometimes even just 5-minute, 10-minute break is okay to just help you come back into your system and also care for yourself regularly. That's not something that that self-care is not selfish. It is actually quite essential, because when you are resourced and regulated, you are able to you're able to become the calm presence that your child needs. So give yourself permission to rest, to ask for help, and to have your needs met. And the last thing is, be kind to yourself. You will have feelings of guilt and worry. You will have self-doubt. You'll wonder what you're doing wrong. And that's okay, because it is hard. So good enough parenting is real parenting. Perfection is not the goal. Practice self-forgiveness daily. Celebrate the small wins. The love you show, even imperfectly, matters deeply to your child. You are doing the best that you can with a very difficult situation. So keep going. And together we can build a community where love and support thrive. Thank you.